Hello and welcome to another episode of Wellness. Today we delve into the world of misdiagnosis, a topic that affects countless individuals and their families every day. We are looking at a much broader problem that many of you have had to deal with: misdiagnosis. Here in Africa, we generally have extreme trust in our doctors and hospitals. Getting a medical degree is not easy. It takes much time and dedication. But with a wide range of health problems, is it getting harder for physicians to diagnose diseases accurately? Dr. Ouma Oluga of the Ministry of Health is here to give us some insights into how medicine is changing and how patients can evaluate the medical advice given. Let's find out more.
Basically, misdiagnosis simply means that that either you are labeled with a disease that you did not have, or there's sometimes that it is actually the disease that you have, but it's in a wide spectrum, and so the specific bit that should have been tackled was missed out. Okay. Yeah, so either something was missed out or you were labeled by something that you did not have. You know, it's sort of somebody telling you that you have a brain tumor, but you don't. But you don't, yeah. And so I'm sure it is one of the biggest problems within the healthcare sector. On one aspect, misdiagnosis is a very costly, both in terms of life and in terms of money, yes, and of course in terms of time. But on the other aspect, it is for this kind of reasons that the healthcare sector keeps to doing research, so that we can find more scientific, or what we call reproducible or evidence-based ways that diagnosis can be accurate. Yes. I am a physician myself. I'm a specialist of internal medicine with a lot of interest in cardiology, so I do understand the whole concept about sometimes missing the diagnosis. And I think what is most important for healthcare systems to do is to institute measures that can filter errors, and errors include things like misdiagnosis, but also that can strengthen the capacity of the healthcare system to accurately predict what people are suffering from. So there are three things that I'll talk about. One is that medicine generally is a very new phenomenon in terms of what we call modern medicine. Okay. Yeah, it's less than 200 years old. Yeah, if you're looking at many medicines, many technologies, many vaccines, they were discovered between 1928 and now, so they're not even 100 years old. Yes. Yeah, if you're looking at many antibiotics, it's from 1928 all the way up to 1960s. Yes. Yeah, some of them as late as 1990. Some of them are, especially antivirals, as late as the early 2000s. Yeah, if you're looking at technology for diagnosis, yes, apart from for example, X-rays that happened in the 1800s, the rest are fairly new phenomena. MRIs, the CT scans, these newer technologies. There are things that have happened in the 1990s all the way as late as 2010s. So that means that medicine is an evolving thing. So the first thing is that the profession itself is maturing. That's why we professionals usually say that if you read a book in medicine, you are 10 years old, like you are 10 years behind. Okay. If you read a journal, you're 5 years behind. If you read an article, you're 2 years behind. And so, because things change so fast. Yeah, and it just shows how young the profession still are in terms of finding better cure and things like that. So that's the first thing. The second thing is that many healthcare systems have instituted measures that we call evidence-based practice. Evidence-based practice is now more than 25 years old, where there needs to be a way to show that the decision that you made was backed by some facts.
Yes.
And those facts often are based on research, scientific research, and we generally grade research into four. Into four, where the first bit is multi-center randomized control trials that have shown the same thing, have shown that if you come to me as Wanjiru, that what I am thinking that you have is what has been shown in more than 4 or 5 trials that you would have if you are subjected to the same conditions, whether in America or Africa or anywhere. The second level is now when there is several patients that have been studied, but it has just been one study, for example, one trial. The third level, of course, is based on one study or several studies, but they were not controlled trials. And then the fourth is expert opinion. So you can see where expert opinion comes. It comes in as number 4.
Okay. Yes.
You get the point?
Yes.
That my expert must combine with another expert, and then it must rise to several thousands of patients in a study, and then those studies must have a case basis in terms of control. So you have a cohort that has the problem and a cohort that is used as an example, or as, you know, and you compare. And then now if you do many of those cohorts, then now that's the best evidence that there is in healthcare.
For patients who have been misdiagnosed, a medical visit can become an ordeal, but one shouldn't go to the doctor completely unprepared. There is plenty of medical advice to be acquired online.
I think the reason it took so long is because most of the doctors around maybe don't even know the existence of such a condition. And again, there could also be issues of misdiagnosis, whereby you find that maybe someone was given a wrong diagnosis, maybe, and the condition maybe that they got to know they have, maybe it's not even fibromyalgia. And with time, I guess, before you get the correct diagnosis, it takes time. Initially, when my symptoms started to arise, I just went to a local hospital.
Yes.
Then after, I was referred to go to Muranga District Hospital. And at that time, the symptoms I had were very severe back pains. I used to have a bloated stomach most of the time. At times I could have migraines, and apart from that, I think I used to experience a lot of fatigue. And at times you'll find that you have fatigue, but maybe you've not done a lot of work, or maybe walked for long or something of the sort, but you don't know where the fatigue is coming from.
Yeah.
Okay, at first, when I went to our local hospital, they gave me just some painkillers. But the problem with that, you find that since it's not like they've established something wrong, it's just that the painkillers may be used to work just for a few hours. But you're not getting any significant change in terms of the pain that you're experiencing.
Yeah.
Okay, at the general hospital in Muranga, at first they were, I think they were speculating I had arthritis. But they were also telling me at that age it's very rare for someone of my age to have such a condition. At first they gave me some painkillers, and then they recommended that I should do a thermotherapy. So I used to go for those therapies like maybe twice in a week. But then again, I'm not even getting the correct diagnosis or experiencing any significant change. I just decided to do away with it. However much I was experiencing pain,
Yes.
we were trying to look for something else now, maybe an alternative in terms of treatment.
Yeah.
At some point, we were even thinking of trying herbal medicine, but it never got there.
What is most important is for anyone seeking healthcare, that is patients and their caregivers, to be cognizant of how to identify the places that they can accurately get the proper healthcare. Because I mentioned that misdiagnosis is extremely costly.
It is.
For the patients, because it delays identification of problems. It sometimes even leads to death. And I'm sure there are many cases that have been highlighted in the media of misdiagnosis. So of course doctors go through a lot of challenges, but I think what is important is actually to talk about patients, because you know, just the other day was World Patient Safety Day.
Yes.
And patient safety means actually instilling those kind of things,
Yes.
that ensures that you can identify that something right is being done. And so I distilled 5 questions that are very important for anyone seeking healthcare to ask themselves. Yeah. And of course I may reference, but I think some of those questions, number one of them, which is very, very, very important, is that were you part of the decision of the services that you were offered?
Okay.
Yeah, in terms of, if I am treating you,
Yes.
did I properly engage you in making that decision? Okay.
Yes.
Number 2 is that, did I communicate properly, you know, in terms of explaining to you and making sure that every medicine and every disease that you are having, you also understood what I am trying to say. Okay.
Okay.
Number 3 is, did you identify any misunderstandings or errors in your medication or in the interventions, or did even your caregiver identify it, or did somebody else who is a second or a third opinion identify it? And the other thing is that if the treatment that you got, did you get better or did you get worse? And if you got better,
Yes.
was it because the thing resolved on its own, or was it because of the intervention?
Okay.
Like, what's the timeline? How long did it take you to get better?
Yes.
And if you got worse, was it because of the treatment, or was it because of your disease? Because if you get worse,
Yes.
often you
Yes.
can get treatment that harms you.
Oh,
But you
yes.
can also get treatment that doesn't harm you,
Yes.
but then it does not treat the problem that you came for.
True.
So the problem keeps harming you,
Yes.
you know?
Yes.
And that is now the bit about misdiagnosis.
Misdiagnosis.
Yeah.
We are fortunate to be joined by someone who was misdiagnosed for years but has come out of his situation okay, physically, and a little wiser.
Okay, in between, I think I've been in and out of so many hospitals,
Yes.
both private and public.
Yeah.
But in all those hospitals that I've gone, you find that everyone is giving you a different story. Because they are speculating, but they are not sure, like, this is the condition that maybe this is the particular problem you're having.
Yeah.
And you see, I've done so many, let's say, like scans, like x-rays. I've done a couple of them,
Yeah.
and they would find nothing wrong. So most of the
all
tests,
these tests are coming out negative.
yeah, most of the tests were negative.
Yeah.
And they were just telling me to keep on trying, and maybe we'll get to know, maybe even as I advance in terms of age,
Yes.
it will be easier maybe to get the problem. I started to experience very severe back pains
Okay. Because of the cold.
because of the cold, and it got so extreme, so I just went to a local hospital. Then they referred me to Kerogoya District Hospital by then.
Yes.
And when I went there, they just gave me painkillers. I took some x-rays.
Yes.
But at first they could not see any problem. We did another x-ray.
Yes.
Then I was sent to a specialist. And at that point, the specialist came to a conclusion that I had a condition called spondylitis.
Spondylitis.
Yeah, spondylitis, it's a disorder to do with the spinal cord.
Okay.
And I guess they came to that conclusion because I think one of the major problems I've had since the year 2003 is those severe back pains.
Yes.
And for the longest time, I actually thought I had a problem with my spine.
Okay.
And you see now the specialist that I met now gave me the
That's
same
confirmed.
conclusion as well.
Yeah.
So I was even relieved thinking that it's the real problem that I had. And since they gave me that diagnosis, now I had to get some medication for that particular condition.
Yeah.
And I was also doing some thermotherapies. At first, I think I did them for like 2 consecutive weeks. Then with time, they just did, I think we just did them for like maybe thrice in a week. They just go reducing with time.
Okay.
And despite doing those therapies and being on medication, there was I would say it's just a slight change, and with time I think I started even doubting the diagnosis. Yeah, because it's not working at that time.
Yes.
And it took me some time, because okay, they just go on reducing maybe the thermotherapy sessions, but you're still on medication, maybe you get more medication, but you're not experiencing any significant change.
Many afflictions can be inherited, so looking at one's family history can be helpful. This is not a call for self-diagnosis, just a suggestion that you arm yourself with information before going to see a doctor.
Respect.
So are you telling this person who
Yeah.
goes maybe to the doctor, to
Yeah.
their local machinani hospital,
Yeah.
when you go there, are you saying that when the doctor maybe is diagnosing you, they should ask questions? Maybe what is this
Perfectly.
medication you're
Yes.
giving me?
Yes.
Yes. Okay.
That's the only way.
It's
You
okay.
should ask questions.
Okay.
And now the question, the thing is, what questions are you asking?
Okay.
Yeah.
Yes.
So the questions are very simple, and that's what I'm talking about. Is this problem of mine? Can
Yes.
you explain? There is not a single disease
Yes.
that any healthcare worker or a doctor should tell you that they can't explain to you. If they can't explain to you, they don't understand it, and that's a red herring.
Great. Okay.
There is not a single disease on earth,
Yes.
yeah, that somebody should tell you that they can't explain to you. If they can't explain to you, they don't understand it.
Okay.
Okay? There is not a single medication that you should be given, or an intervention or surgery that you should go through, that somebody can tell you that they cannot explain it.
Okay.
If they can't explain it,
Yes.
they don't understand
They
it.
don't understand it.
So that's where your problems start.
Yes. And what happens?
I hope you get what I'm saying.
I totally get what
Yes,
you're saying,
yes.
and I hope somebody listening to
I
us
hope,
today
yes,
also
yes.
understands.
And
what
that
you're
is where, because healthcare systems
Yes.
previously,
Yes.
and I've given these talks before, where they feel like patients are not part of healthcare.
Yes.
So then there's a healthcare system,
Yes.
and then it is for them, it's for patients. Then these patients are some alien third parties
Yes.
that just come into the system and they go away.
Yes.
Yet patients are the reason why healthcare systems exist. So if they can't explain it to you,
Yes.
they're not solving your problem.
Okay.
So that's the first thing,
Yes.
in terms of did they explain it to you. Number two
Yes.
is, after they have explained it to you,
Yes.
have you participated in making the decision?
So someone is asking, how do I make that decision?
If I understand my problem very well,
Yes.
then I participate by making the decision, and there are 3 levels of participating in making the decision.
Okay.
Of telling the doctor, give me these options, and by the nowadays they are also, okay, of course they are gold standards in
Yes.
terms of treatment, but because of our healthcare system, sometimes we say that I can do this, but I can also do this.
Yes.
Okay?
Okay.
And I explain it to you based on
Yes.
your, let's say, body options, or your healthcare status, or the emergency that is available. And so participation in the decision means that I said yes to this option after understanding it.
After, okay.
After understanding it, and I
Yes.
consented. Of course, there is verbal consent and written consent. Nowadays, we prefer written consent,
Yes.
but of course, in many medications, it's verbal consent. So it's not just about me saying yes. It's about also understanding that treatment option,
Yes.
not just the disease.
Not just the disease. Yes.
Okay,
Uh-huh.
me understanding that treatment option, including the complications of that treatment
Okay,
option.
okay,
Yeah,
okay.
so that is participation, and that is very, very important.
Yes.
The third thing is this doctor treating you with respect and
Okay,
dignity?
yes.
Because most misdiagnoses are errors of communication,
Okay.
where patients lack the power
Uh-huh.
to either engage, participate, or challenge
Yes.
what is happening to them.
Yes. Yes.
And this is really what is happening in our healthcare system. Because of queues, healthcare practitioners have become like small gods. So they start telling you don't understand, they start telling you things like that. If they are not treating you with respect, they're
Yes.
shouting at you,
Yes.
red herring,
Yeah.
you are likely to be misdiagnosed. There are some disease patterns that we are seeing now.
Yeah.
Sometimes it takes more than 100 years or 40 years
Okay.
for a pattern to be built.
Yes.
And for a pattern to be put together in form of science that you can now say this is fibromyalgia.
Yeah.
But before that happens,
Yes.
fibromyalgia may have existed, but maybe it was not being seen by doctors more often.
Okay.
So the doctor that may be in front of you may not know what fibromyalgia is.
Yes.
Either because it is not their specialty,
Okay.
or they have never seen it,
Yes.
or maybe the disease, there are those things that we call rare diseases. Okay? So this is something that also healthcare practitioners must be aware about. But I think what is most important is that your doctor must also be quite curious to be
Yes.
able to navigate with you the healthcare system,
Yes.
so that you find the exact problem.
Yes.
Yeah, because it is not always true that when you are sitting in front of a doctor or a nurse that they know what your problem is.
Yes.
But there is a level of curiosity which is inculcated within the practice and within the profession,
Yes.
that should allow them to lead you through. So for example, when you come with fibromyalgia, the biggest problem is pain. Pain.
Yes.
So then your doctor may tell you things like, I think you may have ABCD, but it may not also be the problem.
Yes.
For now, your biggest problem is the pain. So I will
Okay.
manage your pain
Yes.
as we go through the process of trying to find out where this pain is coming from.
Yeah.
Okay?
Okay.
So that way you are also, of course it may also be really daunting that, oh, why are they not finding my problem?
Yes.
But sometimes it takes a bit of time for some diseases to show up, especially what we call connective tissue problems like fibromyalgia, yeah, which are connective tissue problems. And they are connective tissue problems that manifest sometimes depending on the state of the body or state of hormones or some triggers or several things, or they take many years for them to what we call mature.
Yes.
or to manifest properly in a set of symptoms that then you can put together and conclusively say this is fibromyalgia. It may just manifest by one thing, but maybe the other aspects have not yet showed up. So, but I think that being said, I think for patients is not necessarily to go through that hurdle in their heads, is to have the assurance, again, that is why communication, dignity, respect, feedback, participation in decision making comes in, to be able to be led through that process of decision making.
Okay.
Because our healthcare system is very difficult because it has not yet put filters or what I would call standards. Filters generally are standards to be sure that when you see Dr. Oluga and tomorrow you see Dr. Wanjiru, that you're getting the same diagnosis.
With time, my mother recommended that I should get like a second opinion in regards to the problem I was having.
Yes.
And we decided I should go to a private hospital. So in Kerugoya, there is one of the major private hospitals. And I used my mom's NHIF card to just go and do some tests there. And at first, when we did the tests, I also informed the doctors the diagnosis had been given at the public hospital. And I explained that to them what I've been experiencing over the years. But at first, they were very skeptical about it when I told them I got a diagnosis for spondylitis. And they told me from the assessment, maybe it has something to do with the nerves. But at that time, they could not like conclusively tell me it's the nerves or something.
Yeah.
So they recommended I should go back to the hospital with the x-rays I had done previously. And after examining the x-rays, they told me that my back had no problem, and I was shocked.
Wow, after taking all these medications.
Yeah, they told me my spine was okay. So from then on, they recommended I do a couple of tests as well. So we did quite a number of tests, and most of them would come out negative. So they tried to establish maybe what was the source of my pain. And at first they told me there's a condition called fibromyalgia. Actually, that's the first time I heard of a name, fibromyalgia.
After all these years.
Yeah.
Okay.
But the doctor told me the best thing I could do is do some research on the internet, take time, get to know the condition. But they'll also have to recommend some more tests and scan. They check so many things. Your back has no problem, your blood is okay, all those things.
Yes.
So at that time, That is when they gave me the results just to take back to the private hospital in Kerugoya.
Yes.
And the doctors just looked at the results, and they also asked me in terms of, there are some pressure points in terms of pain on my body, and then actually concluded that I had fibromyalgia.
Are there, policies that are there in place, for cases of misdiagnosis, for a doctor or a healthcare practitioner to be held accountable for medical error?
Yes, of course, there are cases of, people who have been held accountable.
Yes.
People generally think it is difficult, but it is not difficult.
Okay.
So the way to get doctors to be held accountable
Yes.
for the diagnosis that they make is to report. And the way to report is to report to the medical council. There's a medical council, that is the body that is responsible
Yes.
for registering all hospitals, and also the body that is responsible for registering all doctors. And they're also the ones, in a way, that look at cases of professional misconduct or professional negligence or professional malpractice. Those three things are different.
Okay, they're different.
Yes, so negligence means I did not adequately do what I'm supposed to do
Yes.
to help you.
Okay.
Malpractice means I did the wrong thing.
Yes.
Misconduct means I did the correct thing,
Yeah.
but I misbehaved in the way of doing it.
Okay.
Those are now where places, things like sexual harassment comes in,
Yes.
things like rudeness comes in, or the doctor beat you. So they gave you the correct medicine, but they slapped you.
Okay.
You see the way
Yes.
the nurses, for example, were being accused before.
Yes.
So you go to a facility, you are delivering,
Yes.
but you are slapped
Okay.
while delivering.
Yes.
So that is misconduct.
Misconduct.
So it's not necessarily that they did the wrong thing, but they misbehaved. So there's misconduct, malpractice,
Yes.
and negligence.
And negligence.
And those three are different.
Totally.
But there, it's one body that looks at it, all of them. And any of those three
Yes.
can harm you.
Yes.
Yeah, because it changes your attitude towards the health intervention. It also causes a barrier to your participation within the healthcare. Because if a doctor slapped you, even if they gave you medicine, you're likely not to take that medicine.
Yes.
So, that already has contributed to your harm.
Okay.
You get. So these are things that are important. So people need to report. But of course, sometimes it is extremely difficult to, people say, oh, where is the medical council? What's their number?
Yes,
blah,
please.
blah, blah.
Okay.
And so I see increasingly people are reporting to administrations.
Yes.
And sometimes administration is the person that is closest to you,
Okay.
whether it's the chief, because we must make people to, then they can now help you to go and report, in terms of these cases. And so there are mechanisms for which doctors can be held accountable. There is also something that is called self-regulation, where the doctor can be reported to their colleagues, the peer, so that their colleagues can determine whether that doctor is continuing to practice or not.
Or not.
And that's peer review. It's a bit more complex, mainly if you can go to another healthcare practitioner to report your case to the association of the doctors. Okay, so that is where now when you seek a second opinion, sometimes you can ask the doctor now who is making the correct diagnosis. Okay, so now doctor, can you also help me to highlight this case so that then somebody else does not go through the same. Yeah, because sometimes people complain about misdiagnosis, but then they are quiet. So somebody else continues to go through that other doctor that misdiagnosed them. And and some of these doctors or health practitioners that misdiagnose people have the highest number of patients actually.
Yeah, why is that the case?
Because most of the time,
Yeah.
to practice medicine properly, or let me just say healthcare practitioners, not just doctors, because doctors are a minority.
Yes.
So to practice medicine properly, you don't need shortcuts. But because people are looking for quick relief, some people have shortcuts.
Okay.
So the people that offer all of this are sometimes the people who may also quickly get the wrong problem or give you the wrong intervention. And you spend a lot. And this is the reality that nearly 33% of all our diseases are not the diseases that people. So it's bigger than the people who complain.
Okay.
Yeah, it's bigger than the people who complain. And sometimes what happens is that people go through healthcare systems, they go to clinics, they spend a lot of money, by the time they're getting to the proper the doctor or the proper hospital, their money is gone. Yeah.
Yes.
So this is really a big problem, and I hope that we can begin to tackle it as a country, because it is harming people,
Yes.
and it is harming healthcare systems as well. Yeah.
Thank you for watching Wellness with Wanjiru. My name is Wanjiru Thuku. Until next time, goodbye.